If you want good medical care, you have to be able to argue and understand the basic principle, the pure principle in saying the government shouldn't be involved. They have authority and an obligation to be involved in veterans' health care, but for delivering health care to the whole society is a mistake. And that's why medical care is going down and the price is going up. I have said many times on the campaign that I don't want to cut health benefits, especially to the elderly or to the children. That is not where I would stop. And if we continue to do what we're doing now, we're going to have runaway inflation. There's not going to be any care for anybody. Social Security beneficiaries aren't going to be able to receive anything. So that course is doomed. And that is why, in many ways, I take a very moderate approach, even though I have a thought about how pure of a program we should have in getting the government out of the way. am willing to work toward sanity by not cutting health care benefits until we solve our problem of this horrendous financial crisis that we have. But you know, it is said that there's no big problem with medicine. The big problem is it costs too much. And that is a big problem. And in many ways, if it didn't cost so much, it wouldn't be quite the problem as today. You could go out and buy an insurance policy or whatever, but because of the crisis, they come along with these mandates and more undermining of your liberties, taking away your right to make your own decision. Instead of moving in the direction of these medical savings accounts, the country's moving in the direction of being told that you will do this and you will do that, which means that there's going to be rationing of care and there's going to be a poorer quality of care, and it won't solve the problem of why it costs too much. Medicine is the only profession or business or entity in this country where technology hasn't helped lower the cost. Just think of how much technology has helped businesses. The more technology, the less people you have, and prices go down, and you can accomplish much more with technology. But in medicine, it isn't the case because the government's always churning money into there, and it pushes up prices. We should have more competition in medicine. People get very nervous about competition. Doesn't the state protect us? Doesn't all the laws and rules and regulations and licensing, FDAs, and all these regulations protect you from having an injury? The truth is they don't. They really don't. You need more competition. They do the opposite. Once they can regulate, say through the FDA does a lot more harm than good. To find one incident where the FDA was helpful, it doesn't justify the use of FDA because they keep good stuff off the markets as well.